This is Chris, everyone, and he just showed me that he's about a month out from upper lower bleph. So take it away. How first of all,
yes,
men make up a small percentage of my overall patient community. Okay, you can imagine. I mean, there's so talk us through why you actually came in to have surgery.
Well, my main reason is I inherited some large eyelids from my mom's side of the family, and it got to the point where I was always waking up in the morning, no matter how much sleep I had, and looking tired, and my peripheral vision began to get affected as well. And then people would come up to me and say, "Man, have you had any sleep? You look tired."
Yeah.
So for me, it was really getting rid of that. I need to also start wearing contacts, and with my lids so heavy and so much, it was such a chore just trying to get my eyes open. I couldn't even get them in.
Interesting.
So that was the main reason.
So that's interesting. So I've tried contacts once and I'm unable to wear, I can't, it's funny, I'm a surgeon, I can deal with eyeballs all day long, but I can't touch my own eyeball. It's a crazy thing for me. So a couple of talking points that I wanted to include for any viewers who are watching this video. Okay. Guys are tough. Okay, so the couple of things on guys that I think make guys surgery a little tougher is, number one, from a pure surgical standpoint, surgery is a little harder. Okay, you bleed more, tissues are thicker. Like for example, I'll be honest, you bled like a stuck pig in comparison to a normal female blepharoplasty. So I'm not saying that men are abnormal, it's just their tissues are different. Yeah. Okay, so it just takes a little longer, it's a little bit more difficult. Second thing, from a surgical planning, as I've told you a couple times, a very important aspect of male surgery is making dudes look like dudes. Okay, you don't want to over feminize them. So on a woman, if I was doing, like, for example, if you were a woman, I would have considered maybe lifting your brows a little bit. I would have, done a little bit more than what I did with you. However, all of those things would have made you look a little either A, effeminate, or B, just weird.
Sure, understand.
Okay, like stretched or something like that, which most guys, they don't have the bandwidth for that. Okay. Right. So you've seen everyone talks about Kenny Rogers. Yeah. Okay. So that stretched look for a dude is just not not something to brag about.
I've had something done.
Yeah, exactly. Yeah. So I am curious. I saw you roughly at about a week out from surgery, and then I saw you now, which is a month out from surgery. Yeah. Walk me through that time period. When did you get back to work? First of all, how was surgery in terms of pain-wise? I told you we're going to do this under local anesthesia, so the whole 9 yards. So walk somebody through there, because I'm sure other guys are listening going, hey, I'd love this, but I'm kind of a little scared. So what does that feel like?
So yes, I came in, you remember, I had a little some high anxiety, right? Oh, yeah. Just knowing that I was going to be awake. The medication that you prescribed really knocked that down. The numbing was no worse than going to the dentist. I would say it was not as painful having, the numbing around the eyes versus in the mouth. After that, I went home and I had a coworker that had referred me to you. And the most important thing she said was the aftercare, follow the directions, do exactly what they say. So I spent a lot of time icing. I think I had 2 different bags in the freezer. So I did 20 minutes on, 30 minutes off, and I did that non-stop. I have the luxury of working out of my house, so I don't have to drive into an office. The first couple of days, I didn't do anything. I think I had it on a Thursday, so I played hooky on Friday and had the whole weekend to do really nothing. Had some help. My daughter came over and took care of the dogs and things like that. But my goal was to really ice as much as I could to prevent swelling. And I also slept on a pillow, on a pillow wedge.
Elevated.
Elevated. Definitely my head above my heart. I did that for almost 2 solid weeks until you finally said, hey, get a good night's sleep, because I'm not a back sleeper. Yeah. But really, my main goal was just to do what I could do to keep the swelling down, and shorten my recovery time and
Right.
get back to looking as normal as possible. I did have I had a facing customer visit on February 13th, and
So that's what, about 9 days after
about
surgery?
10 days after surgery. I had more bruising on the left side than it did on the right. The right was a little quicker, especially on the bottom. But, you know, it really just looked like I had a black eye.
Yeah.
You know, there wasn't a lot of upper lid swelling.
What did the customer say? He asked you if you were in Fight
I said,
Club?
you should see the other guy. But, you know, going back to the surgery, once I was numbed up and the medication was in, it really helped me relax. And it was not that, in my mind, it was going to be a bigger deal
worse
than it actually was.
Good.
Yeah.
Good.
Yeah.
Now, at this point, you're pretty much healed and all that kind of stuff. Happy?
Very happy.
Okay.
I'm
Would
happy
you do it
because-
again?
Oh, absolutely. Absolutely. I've gotten nothing but compliments. You know, a lot of people don't notice because my eyes, I think, look normal now.
Yeah.
Like they should look without the heavy upper lids.
What does your daughter think?
Oh, she thought it looked great.
Yeah?
Yeah. Oh, yeah.
Good.
Absolutely.
'Cause I remember her coming to pick you up after surgery,
Yeah.
and there was a little bit like, you know? I mean, I saw her face was like, whoa.
Yeah. It's
You
like,
know?
oh, Dad.
Yeah.
Yeah. No, I've gotten nothing but compliments on it.
Cool.
So
Awesome.
I'm very, very pleased. Very
Awesome.
happy.
And so one of the things, just for our 7.8 billion viewers on Earth who watch YouTube, so Chris was telling me that he feels that his eyelids are less sensitive. Now, I don't know about that. So in terms of what I mean by that is, I really don't know what the A to B to C of what caused that is. So he was saying he's looking forward to putting contacts in and things like that. So when I do these types of surgeries, I'm not doing surgery. Like if you came in and said, hey, listen, I want to do this kind of surgery that Chris did so I too can put contacts, that doesn't work that way. So we look and see whether you have the anatomical need to do the surgery. And, you know, for him, he feels that he's more able to do these things. So I just want to make that really clear for everybody so I don't get hate mail or weird, because it happens. So I just want to make sure that I'm kind of prefacing that so everyone has fair expectations of what to expect from an upper and lower blepharoplasty.
Yeah.
Cool.
Yeah.
Awesome. What else do you have to say to anybody else out there on Earth that might be watching?
Man, if you're considering doing an upper or lower bleph, I highly recommend ATHRÉ. I've been pleased.
Thanks. By the way, that was not
That was not a plug.
That was not a plug. That was not on a script here before I get hate mail. Yeah.
No, but it's tough because without a referral, I wouldn't have known who to go to. And this is my face, so it's very, very important to me.
So one of the things, you know, I actually, as I was telling him doing this conference and this moderation, one of the things that I just did another video on, they asked me to do a quick presentation on 5 procedures I would never do to myself.
Yeah.
Okay. So when I was doing this video, okay, of the 5 things I would never do to me, and I'm kind of going through them, you know, I realized that all of these things have been created by hype. Okay.
Yeah.
So they went viral. People came in, asked for them. I went to go research them. I may have tried it on, you know, a select patient just to see what the results I'm getting, and then went, I'm not going to do it.
Yeah.
So just as confused as the public is, you can imagine we're probably in the same category. And this was a very self-illumination moment for me, because I'm going, hey, you know, we get tons and tons of these companies coming, we got this new product that does this, we got this new product that does this, okay? And then they're going viral, they're going this, and you feel like you have to jump on a bandwagon. So you recognize, I mean, at this point with the gray hair, I know where I am, what I do, and I'm very comfortable, right?
Yeah.
So, but I can understand what you're saying. It feels like it's very hard to go, hey, this is a place that I need to go to if I want A, B, C, D, E, F, G.
Right.
Okay?
Yeah.
So that's why I think this is one of the reasons why we're shooting these videos, is because I want to show real patients that have had real surgery, unscripted, and what they feel like. You know, so that it just helps other people for a very kind of a a no-nonsense approach on how we do it.
Yeah, I just like what I look like in the morning in the mirror, and you know, my eyes don't feel as tired at the end of the day, that they're just screaming, please close me, please close me.
Yeah.
You know, and it's just, it kind of gives you a little boost of confidence too.
Cool. All right. So this is interesting. We'll talk about that later. All right. So thanks everyone. Thanks, Chris, for sharing your story.
Oh, you're quite welcome. Thank you.